Hello everybody and welcome back to What the Health with Dr. L, where I share with you brief evidence-based answers to important health and wellness questions. And today's question says, why should I care about my blood sugar levels? And the answer to that is unnoticed and undetected high levels of blood sugar can go on without any symptoms for a long time, and that can cause a lot of damage to many body organs, including the kidneys, the heart, the brain, the eyes, the nerves, and so on and so forth. That's why it's really important to check our blood sugar a couple of times a year, once every 6 months, or at least once a year with our physical exam. Unless you have a strong family history, then you need to do that more often. Also, if you are experiencing any of these symptoms, please do not waste any time. Go ahead and get your blood sugar levels checked as soon as possible. That includes if you feel tired, lethargic, and low on energy most of the time, if you feel thirsty most of the time, if you have to go to the bathroom multiple times throughout the day and night, if it's hard for you to heal from wounds and skin breakdowns, if you're susceptible to infection, frequent infection, and it's hard for you to overcome this infection, if you have any itchiness or soreness or thrush in your genital area, especially vaginal thrush, and also if you have any issues with your vision, like blurry vision all of a sudden. Okay, so why does excess or extra sugar cause these problems? As we know, the sugar in the blood should go inside the cells so that it can be turned into energy. But sometimes, because we end up eating too much carbohydrates and sweets and refined sugars, while we are not really moving much, that we end up with too much sugar. Then the cells fill up with sugar and cannot take any more. So that extra sugar stays out in the blood and in the interspace. Because it's too much sugar molecules, they start grabbing into things, including protein that is trying to do a function. They grab into this protein and they end up with something called non-enzymatic glycation. That in turn causes damage to the blood vessels. The big ones, the macro blood vessels, arteries, and the small ones, the micro blood vessels, which we refer to as arterioles. So the arteries start getting thicker and more narrow, and they become stiff and hard, not flexible. So the blood pressure goes up, and the blood supply to that organ becomes decreased or compromised. So blood supply to the heart, if the blood supply to the heart is not enough, we start feeling chest pain, which we refer to as angina, or the heart might start having difficulty pumping blood, varying degrees of heart failure. We might end up with a heart attack. If that happens to the arteries going to the brain, we start having issues with memory or psychological feeling depressed or not feeling in a bad mood. That can contribute to Alzheimer's, strokes, and other issues. If it happens to the kidneys, we end up with kidney insufficiency and chronic kidney diseases, and that might lead to kidney failure. So that's why it's really important to keep that blood sugar in check. And at the same time, if it happens to the small arteries that feed our nerves and our retina, the back of the eye, that can cause either nerve damage and loss of sensation, we refer to as diabetic neuropathy, or it can cause damage to the retina, which we refer to as diabetic retinopathy, The retina is the back part of the eye that it turns all the images we see into electrical signals that travel to the back of the brain so that we can see. Oftentimes, if the blood supply to the retina gets decreased, over time, it causes irreversible damage to the retina, and people can end up losing their eyesight. How can I check my blood pressure? You have two ways. You can have a glucose meter at home. If you have a glucose meter, you can check it first thing in the morning after you get up, and the normal range should be between 70 and 100 milligram per deciliter. Of course, these numbers vary from one reference to the other, but these are the numbers I go by. Anything 100 to 125 is pre-diabetic, 126 and above is diabetic. Okay, or you can also check it 2 hours after you eat, and the normal range should be 140 or less. If it is 140, more than 140 all the way up to 199 milligram per deciliter, you're pre-diabetic. If it's 200 or above, then you are diabetic, and you really need to get some medical help. But a better way to do it is to do the hemoglobin A1C test that gives you the average blood sugar over the last 3 months, and this you will have to go to a lab to get it done. And this is what I would highly recommend. A normal range should be 6 or less, 6 to all the way up to 6.4 is pre-diabetic, 6.5 or above is diabetic. Next time I will discuss with you some evidence-based lifestyle modifications, easy to do, to help all of us avoid getting into the diabetic stage and avoid all these complications. All my best, and see you next time. Bye-bye.